Today we'll go over some taping techniques to help out when we have some ulnar nerve pain. Just as a quick refresher, ulnar nerve runs down the inside arm, rounds through kind of where our funny bone spot is on the inside of the elbow, then goes down the arm into the fourth and fifth fingers of the hand, which would be one of our main symptom patterns, would be the numbness, tingling, pain going into there, maybe with a little bit of weakness. So when a lot of our symptoms are present here at the elbow, as we bend the elbow, especially as we bring the wrist back or elevate the arm, we'll get a lot of tension with the nerve as it rounds across here, kind of around this corner. This can be one of our main hot spots for our symptoms. And sometimes we got to give it a little bit of help while it's trying to recover, in addition to all the manual therapy and other management that we're going to be doing to try and resolve it. So, the ways nerves work, and kind of like why they get irritated with certain stretching positions, is when a nerve stretches, it kind of like crunches down in on itself. So it kind of gives an inward pressure, almost like a Chinese finger trap effect. Pretty decent book on peripheral nerve entrapments. Has like some very good visuals on this. Basically, as the nerve stretches, it kind of goes inward, which is going to increase the pressure. Nerve stretches, pressure inward. There's a little extra shot with the actual nerve bundles in there, how they're going to kind of get pinched on. So as we stretch the nerve as we come through, we could get a little extra of that compression effect in addition to the nerve actually going through the groove with a little mechanical compression there. So we can use some kinesiology tape to try and help take a little bit of pressure off there to make life a little more tolerable in the meantime and kind of expedite our resolution. So we're going to start with just a Y strip, just like so. I'm going to break the tape. And we're going to start with an anchor on the back side of the elbow, like right about here. Because what we're going to do is we're going to take the tape, like two fingers, to almost like help lift the nerve off of the elbow a little bit. Yeah, I think there's probably a mechanical effect of this tape. I know there's internet arguments probably going on right now on whether it's neurophysiological or mechanical and other kind of fun stuff. Well, if it works, makes the person better, great, we'll do it. So we want to see, do we get like a little bit of a pull here? So as I bend the elbow, the tape is going to help give a little extra pressure to try and take some of the kind of that extra mechanical compression as it rounds the corner on the elbow. So what I'm going to do on this side is I'm going to, you can have the elbow probably like about 30 degrees of flexion and go a little straighter, a little more of a bend depending on how the person presents. And I want to put a little bit of tension on the tape, no tension on the edge, a little bit of tension on the tape, no tension on the edge. So I'm going to have a little bit of pull going, pulling the nerve kind of off of the edge of the elbow. So as I bend my elbow, it's going to tense a little more, so I'm going to try and get a little extra lift to help that guy out. Now the second step on top of that, since when we pull the nerve, it has a little extra of that, a little bit of the finger trap effect. So as I'm going across, and that's going to be trying to stretch, I can break the tape in the middle and go outwards to try and pull back to keep a little bit of slack on it. So for that, we just take a standard long strip, break her in half. Main trick with this is seeing when we put it on. So if we put it on over the top here and then bend the elbow, a lot of times the skin will traction over top and it'll lose some of the effect. So we actually have to say, like, if you start with a bend, where would the tape want to be to support the nerve, then straighten the arm out. So I have my anchor down. I can just put a little bit of stretch on there as I go across, no tension on edge. A little bit of tension depending on whatever angle I want to do it, wherever they get the symptom provocation. Layer down, no tension on the end. So as I go back and forth across, so if I go to here where I'm going to get a position where I might get a big stretch on it, I have the Y strip pulling the nerve a little bit this way, and this tension strip is going to try and pull the skin in a little bit just to give a little extra mechanical support, so it's not going to get as much of the traction effect to pull down on itself and create that internal pressure. So as I go across, if I can move a little bit freer and I don't get as much of a zing, or it feels a lot less tension, I don't feel as much upper neck tension with it, that's how we tell it's a successful tape job. So we can keep that on, up to 3 to 5 days depending on how the skin works and workload. Really easy to redo. I just did that on myself, so it is possible to self-tape this guy once you figure out all the right tension patterns or whether it's appropriate or not for you. So that's our taping to support a ulnar nerve irritation at the elbow. Occasionally we can extend this piece to go either all the way up into the neck or all the way down into the hand. That's a little more complex. That's a video for another day. But this would be the basic principles of it. We can apply this to a couple other nerve entrapment sites across the body. So stay tuned. We'll hopefully post those at some point. Any questions, please email us. Have a good day.